Hey there, Chris Westfall. Some news in Medicare. I follow this stuff every day, and yesterday an article came out from BeckerHospitalReview.com, and it says hospitals take aim at Medicare Advantage. One of the things you have to concern yourself with Medicare Advantage is these plans change absolutely every year. The hospitals, the networks, the doctors, the benefits, everything changes with Medicare Advantage every year, as opposed to Medicare supplements where they never change once you ink your signature to the document, and you can go anywhere you want to on the supplement plan. But this is interesting because this article says Medicare Advantage may now provide health insurance coverage to more than half of the nation's seniors, but that's not stopping health systems from pushing back against the growing and controversial program. Did you know Medicare Advantage is controversial? You don't know that if Bill Shatner's on the television telling you how great it is, or J.J. Walker. They only extol the benefits of Medicare Advantage and never what's behind the scenes, and that's what we do here on this channel. The article says hospitals have been dropping Medicare Advantage plans over high claim or prior authorization denial rates. They deny care. We've been covering that on this channel for about 8 years now, since at least 2018, but it's an uncommon move until recently. Some systems have noted that most Medicare Advantage carriers have faced allegations of billing fraud from the federal government and are being probed by lawmakers over high denial rates. It says most carriers have been facing these allegations. Rochester, Minnesota-based Mayo Clinic warned Medicare-eligible patients in Florida and Arizona in October that it does not accept most Medicare Advantage plans, and Vanderbilt University Medical Center in Nashville, Tennessee, was preparing to drop Humana and Centene Medicare Advantage plans before finally reaching contract agreements in March. Camden, Missouri's Regional Medical Center stopped accepting Cigna's Medicare Advantage plans in 2023 and plans to drop both Aetna and Humana in 2024. It plans to continue Medicare Advantage contracts with United Healthcare and Blue Cross Blue Shield, the St. Joseph Press reported in May. Camden Regional CEO previously told the newspaper the decision stemmed from delayed reimbursements. Stillwater, Oklahoma Medical Center ended all in-network contracts with Medicare Advantage plans amid financial challenges at the hospital. Humana and Blue Cross Blue Shield of Oklahoma were notified that their Medicare Advantage members would no longer receive in-network coverage after January 1, 2023. The hospital said it made the decision after facing rising operating costs and a 22% prior authorization denial rate for Medicare Advantage plans. 22% of the time, the people were said, no, you can't have the coverage done.
Prior authorization is a nightmare.
They're spending something like 15 hours a week per physician just filling out these forms and waiting on hold for the insurance companies.
The Brookings, South Dakota healthcare system will no longer be in network for any Medicare Advantage plans in 2024, the Brookings Register reported. The hospital, municipally owned hospital, said the decision was made to protect the financial sustainability of the organization. Brend, Oregon-based St. Charles Health System has taken it a step further and is only considering dropping all Medicare Advantage plans, but is also encouraging its senior patients not to enroll in the private Medicare plans during the next open enrollment period. The health system's president and CEO, CFO, and chief clinical officer cited high rates of denials, longer hospital stays, and overall administrative burdens for clinicians. Quote, "We recognize changing insurance options may create a temporary burden for Central Oregonians who are currently on a Medicare Advantage plan, but we ultimately believe it's the right move for patients and for our health system to be sustainable into the future, and we encourage all patients to move away from Medicare Advantage plans as they currently exist." So what does this mean to you? Well, if you're on a Medicare supplement plan, you're encouraged to probably stay on the Medicare supplement plan. Medicare supplement means you have original Medicare, which is pretty much every doctor at every hospital in the country, with very small exceptions. And you can go to any of them without referrals, without prior authorizations. If your doctor says you need something done, it's just done and it's paid for. Medicare paying their portion as decided by your doctor, and then the supplement plan having no decision-making authority whatsoever, just automatically pays what original Medicare leaves behind. That's why they call it a Medicare supplement. Meanwhile, in the world of Medicare Advantage, most all of them are based on a network system. Even those that are not based on a network, the PPO plans where you can supposedly go anywhere that you want to, if it's not authorized by the plan, they're not going to pay that claim. Understand that. Just because an agent tells you that you're on a PPO plan and you can go absolutely anywhere, what they're not telling you is the small print, and you need to read the small print on a Medicare Advantage PPO plan. What they say is, as long as your out-of-network doctor agrees to their payment schedule and furthermore agrees to bill your health plan on your behalf and wait for that reimbursement if they accept what they had done for you. So first of all, is your doctor going to stop everything they're doing in their billing department and set up a billing system just for you for one patient? You better check with your out-of-network provider first. If they say it's an out-of-network coverage, that means it's a possibility. It does not mean it's a guarantee. And so every year we warn our clients, you're going to get a lot of advertisements in the mail. You're going to see televisions, every restaurant, every bar, everywhere you go, covered with Medicare Advantage advertisements talking about free dental, free vision, going to give you money back. All these things that pertain to a very small select number of those plans, but what they're also not telling you is when you go to the doctor, more than 75% of the requirements of going to different things that you're going to have done all require prior authorization. So for instance, if you have a knee that's giving you a whole lot of trouble, your orthopedic surgeon that you go to says you need a knee replacement, you're the perfect candidate for that. They may say, no, let's try some steroid injections first. Let's try some physical therapy first. Why? Because it's cheaper. And Medicare Advantage plans are not Medicare. They're private plans enforced to make profit. And what they're going to do with the profit is they get a certain amount of money from the government and then a certain amount of money they have to spend on your health care. That difference margin there, that's their profit. That's called the profit margin. What they have to spend versus what they're getting for you from the government. So even though you have a free plan, no premiums required whatsoever from you to be in that plan, understand that the government is giving them a set amount every month, and how much they spend on your health care takes away out of their profit. So what they do routinely, as we've covered thousands of times on this channel, is they try to reduce care. And what that does for you is if you're in pain, if you're in agony, or if you're near death's door and you need a certain procedure done and it's expensive, you can just bet it's going to take a while for your prior authorization. Then sometimes they're routinely denied on the first case. And the Office of Inspector General's report found that if you appeal the denial, which is often routine, if you appeal the denial and appeal and appeal and appeal, eventually it'll probably get overturned. But how many people want to sit there in their hospital bed, and how many don't have an advocate to go do these appeals for them, and they just wait and they wait and they wait?
How would you define the problem?
What our work showed is that prior authorization was being used at times when original Medicare would have paid for the service.
Do you think just prior authorization itself is the problem, or just not administered properly, or people aren't following the guidelines?
Our work looked at and showed that while prior authorization is useful as a tool in Medicare Advantage, it's that time when original Medicare would have in fact paid for those services that created the problem.
So eventually, yes, they may do the right thing for you, but you're going to get that denial first in many, many cases. We just have seen it too many times. Just want to bring you the truth. If you need help picking the best Medicare plan that might be suitable for you, that's why we exist here. I'm going to continue to bring you the news as it exists here. And this is new. This is hospital system after hospital system after hospital system saying we're sick and tired of waiting for prior authorization while our patients sit there in agony in our hospital system, ultimately to be told we're not going to pay you at all. So they're dropping the Medicare Advantage plans. These plans, again, change every single year, and a Medicare supplement plan, if you were to go that route, does not change. And that's why it's a little bit better. Not for everybody. Not everybody can afford a Medicare supplement. And if you waited past your open enrollment period, not everybody can qualify for a Medicare supplement. And that's why we try to be all things to all people, but we're going to tell you the truth first. We're not going to shove a plan in your face to get paid double the commission, which is literally what it is, to enroll you in a Medicare Advantage plan without first telling you the truth. That's why we exist. And if we can help you, please let us know and reach out. God bless you. Thanks for watching. Bye-bye.